Managers at the old Vicarage care home in Stallingborough say they're down to just 8 members of staff. They don't have enough staff at the moment to look after their residents. They've told us there is a solution, but they've been told it isn't possible. We can find out more. Paul Savary is the Managing Director of Home from Home Care, who run that home in Stallingborough. Paul, hello, good evening.
Yes, hello, good evening.
Tell us, what is the situation then in your home?
Well, the first thing is that everybody is safe, that we are in control of the situation, that we've gone to our sort of plan B. We're at level 5 on our business continuity plan, and we do have enough staff to provide a safe service. What unfortunately happened was that we have had a large number of our staff test asymptomatic, and that has absolutely sort of upended our staff team, and we would have hoped to have sort of been providing, in terms of the recognition of carers to the individuals that are being supported. It's very important, that side of it.
So you're down to 8 members of staff, is that correct? I mean, what in terms of safety and so on, what does that mean?
Well, that's 8 of the original 32 members of staff that are there, but we've put extra staff in from our offices or from our non-operational side, but staff who actually have a care background, very senior members of our team, and they're going back to basics, and they're supporting staff there. And we've also had to move 1 or 2 staff from out of county in as well.
So you think you've got a solution. What is your solution to get around this then?
This whole issue is, have we been pestering or trying to get Public Health England, to get North East Lincolnshire CCG to consider what we thought was a very good solution. If you have a situation where, with very complex individuals that we're supporting, their sort of knowledge or the knowledge of them by their support workers is incredibly important. And this links, if I might just say, to Public Health England, who yesterday brought out a report which said that people in the category that we support are 30 times more liable to die in COVID-19 circumstances. So Public Health England have identified the people that we're supporting in the very highest level. Now, we understand that. And what our solution very simply was, we were saying to all of the parties, trying to actually establish who it was that would actually we could actually talk to, because you really don't know, because everybody passes, public health passes you on to local, CQC are in the background, God knows what. But anyway, the point we said was, we can safely transport staff who are asymptomatic, who are at home waiting desperately to come back in, and we can safely transport them to the home. We can take them into the home through separate entrances. We can give them an environment where they can sort of change clothes, etc. And they could then support the individuals who have already got COVID-19 and who are in a bubble. So there is no downside in terms of somebody with COVID-19 asymptomatic, supporting an individual who has tested positive to COVID-19. There's no downside to it, except we are being told that that would break the law as it currently stands.
Why is that then? Why can you not do that?
Well, Public Health England say that basically, and we've had communication with the with Chief Executive, they have said that is breaking the law under COVID legislation. Now, we would challenge that in the normal course of events if we actually had time legally, because we're not sure that's one interpretation, but there is another interpretation around safety and so on. So they're saying you can't do it, and they're saying, anyway, this is not our decision to make. There are decisions that can be made locally by the local authority. So then you go to the local authority, and the local authorities say, no, we can't change any of this because Public Health England have said that you'd be breaking the law. And in the meantime, CQC, Care Quality Commission, who are the regulators and who are saying nothing, they should actually be looking at this, and they should be saying, well, hang on a second. Public Health England, you're saying that the provider cannot support the individuals in a way that will minimize the risk of them getting COVID and so on, but through good support. So why is Public Health England going against what it's actually saying, which is these are the most complex individuals. They are 30 times more likely to die of COVID-19. So everybody's blocking it and nobody will take responsibility.
Are you looking now to the future, Paul? Are you confident then that you're able to cope with this now?
Yes, we will find a way to cope with it, but at what price? Because we're having to take staff from elsewhere. We're having to basically stretch the staff who are actually in there. And it's completely unnecessary, because there's a piece of legislation that says somebody who is asymptomatic cannot go in, this is what they say, and actually work in a care home with people who have already tested positive. We wouldn't have a problem, and there would be no problem. And this is a much bigger issue than us. This is a national issue. And one of the things is that we function and operate with an incredibly advanced IT platform. So everything we do is totally transparent and can be seen by everybody. The reality is other providers, and it's a known fact in the sector, they are actually supporting people with asymptomatic staff. It's not coming to light around all of that. And why should they bring it to light? Because actually it would just cause an even bigger problem for them, because then you end up with no staff. In exactly the same way as the Minister, Helen Whately, said, oh, well, we're doing more and more testing. This is great. Well, hang on. If you test more and more people, then you understand that more and more people are asymptomatic, and you simply drain the staff out of the care homes. So it's great having the knowledge through the data that you've got so many asymptomatic people, but then you have to change your way of operating and allow, well, what do you do in that set of circumstances? And nobody is thinking beyond that. So in a way, we're in a sort of Mexican standoff with PHE, Public Health England, CQC, and the local authority, and we're the ones who are trying to protect these individuals and saying they need a certain type of staff. And so it's not a happy situation.
Paul, thank you. Paul du Savary there, who is the Managing Director of Home from Home Care, who run that care home in Stallingborough.